try to showcase the efficacy of homeopathy in some rare and so-called incurable diseases. The first disease I would like to talk about and the cases of epidermolysis bullosa. It is an inherited disorder, rare genetic disorder, and has four main types: simplex, junctional, dystrophic, hemilesnosomal, and dystrophic. These you can see. This is a simplex. This is dystrophic. You can see complete layer of the skin is gone, and at the junction of the neck and head and the folds, the blistering is happening. So this is a case of a newborn boy. He was just 9 days old when he was brought to my clinic. A huge bulla had appeared on the thigh of his left thigh. Blistering was happening and the skin was chafing off. There was complete peeling of the skin. Even small touch or a simple, friction from any kind of a surface was leading to blistering and peeling of skin. He was born absolutely normal and on the ninth day, as I said, appeared a big bulla. There was no discharge, no pain, and child was seemingly in no distress. Full-term vaginal delivery. Pregnancy was absolutely uneventful. This is how, if you can see the hands, the face, it's all covered in scabs. And you see the legs, you can see whole blistering and scabs, the neck, the ears, the hands. This was a huge bulla that appeared on the back as well and the thigh. Complete body and skin is damaged. So I prescribed him just one dose of sulfur 30. This was a case of consanguineous, a child born out of consanguineous marriage. Parents were related, and hence a genetic disorder that happened. Sulfur 30 single dose was given, and calendula mother tincture, because such a case is prone to a lot of external infections. And foremost importance is to prevent any further, infections. So I truly believe that calendula mother tincture, when applied externally, acts as the best antiseptic. And it was just asked to just rub off the scales and the body with mild 5-10 drops of calendula mother tincture with just one dose of sulfur 30. You can see by the 4th day itself, the child was much better. The scab started reducing. The peeling of the skin also lessened. There was no blistering also. There was no further blister formation. Yeah. The skin, general condition of the skin was much better after 20 days and it regained normal texture. But there was depigmentation. I'll show you the picture on both the wrists, and scalp hair of the frontoparietal region very less. So just a dose of, 2 doses of hydroxyl 30 I prescribed on this basis. Yeah. And by the next week, depigmentation started reducing. And it a pathonomist process and a process of recovery only. No medicine was given, and after exactly 1 month of homeopathic treatment, he was much better in general. But mother complained that he was passing urine every 10 to 15 minutes. So again, because he's a child, there could be many reasons of that, and there could be a mild UTI as well due to the diaper or due to any other thing. So just one dose of costume 30 was given. You can see the difference. In just 1 month of homeopathic treatment, complete skin regain, completely normal texture, no blistering, no scabs, no reoccurrence of the blistering. He was being handled very nicely. He was a boy of a Fauji and coming from a very low socioeconomic strata. But they came directly to me, and by grace of God, he's now 14 years old, and no recurrence has happened, no blistering formation has happened, completely cured. You can see. He was put on Saclac only. He was advised to continue with calendula mother even if there is mild. Yeah. So the second case is Spasmodic Dysphonia, again a rare neurological disease disorder. Very rarely do you find it across such cases, but very common in people who are in public speaking profession or and high stressful jobs. So again a neurological disease, but a rare one that has been termed incurable by the modern medicine, but homeopathy has done wonders. It is again of three types: adductor spasmodic dysphonia, abductor spasmodic dysphonia, and mixed spasmodic dysphonia. It is where the laryngeal muscles, there is involuntary movement of the laryngeal muscles, causing difficulty in speech. It can be a whispering, it can be complete aphonia, it can be even breathlessness with mild speech. So this is a case of Mr. Shakil Ahmed. He's from Karachi, Pakistan. He's a Maulana. He consulted me obviously via video call, and he lost his job because he could not speak, and the whole family was he was the only sole breadwinner. Presented with a very hoarse voice, it would crack after just speaking 2-3 words. He had to strain while speaking at a normal pitch, and would sound clearly whenever he would shout. This is a general symptom of this disease itself. If the patient is speaking out loud or singing, he would still sound better or normal. But even at a normal pace, it would appear as if the patient is just whispering, or even you wouldn't be able to hear properly. There was breathlessness when attempting to talk, and also at chronic sinusitis with cardiomyopathy. As I said, he had been a public speaker for 25 years almost, and he had a rift with his son, which led to this gradual complete loss of voice. This would aggravate in any social gathering, grief, and or talking out loud in morning, and vocal rest would make it better. He had shown to various neurologists in Karachi and other areas of Pakistan. Thirstless, thermal reaction was hot, usually a calm person, but would get anxious of late about his family as he was the sole breadwinner. Strong-willed, cannot tolerate any contradictions. I prescribed him Ignatia. As you can very well understand, there was a history of grief, and grief was ruining his complete life in all aspects, and he lost his voice also. And because he was a public speaker, I also prescribed Agendum Metallicum 30 to be taken separately. Ignatia gave some improvement, but not very satisfactory results. It continued for about a year or so. I even went to Agendum Metallicum 200, but not very satisfactory results. Then he had to stop the treatment for some time because the financial condition was not such, and he again contacted me after a year. We again took up the case, and this time I gave him Stanomet 30. Stanomet 30 was given precisely on the fact that he would feel extremely breathless while talking. Even a small word would make him absolutely out of breath. So on this symptom, Stanomet 30 was given, and he started improving magnificently. Within a few months' time, his voice was 90% better, and today he is completely cured, and he's on no medication. He's gained his job back. He's married his few daughters also now, and this is his video.
कराची के रही हैं तकरीबन 2020 में मेरी तबीयत खराब होनी शुरू हुई थी तो मेरी आवाज बिल्कुल बैठ गई थी। फिर वो आई थिंक 2021 में आवाज मेरी बिल्कुल बैठ गई, अब आवाज निकल नहीं पा रही।
You can appreciate how clearly he's speaking at length and not even falling short of breath at even a single word or even at a long sentence. This is a pretty long video because he's giving his testimonial and blessings to me as well. So thanks to Homoeopathy that he's been, at this age he got his job back as well. This is a fantastic achievement and gives a lot of encouragement to people like us that nothing is incurable. Thank you.
Dr. Sanket